Okay, well, I figure we should probably go ahead and get started if people join in a couple minutes. That's good too. It looks like most of you have joined these before, so I'll keep the intro nice and short. But thank you again for joining us. If your connection allows, feel free to turn on your camera and participate as much as you wish. We'll have a brief presentation from Rachel Gilbert, and then we'll have the group discussion following that. It's my hope that these sessions will foster lots of conversation and share perspective between people who might otherwise be meeting. And as Alex mentioned in our last roundtable, for those of you who are here, we will be starting another research community next month. So look out for some communications about that. And I will pass it over to Rachel now.
Great, thanks, Nola. Hi everyone, my name is Rachel Gilbert. I just finished my PhD at Tufts at the Friedman School, and I am going to be presenting some of my dissertation work today. The title of this work is Revealed Preferences Towards and Away from Healthy Diets, and it's really an exploration of household income and diet quality in Malawi from about 2010 to 2019. So the motivation for this work, I won't spend too much time on this because I think this research community is very familiar with this, but basically around the world, diet-related disease is on the rise. There's still widespread undernutrition, particularly in some of the low and lower middle income countries, such as Malawi. There is um, a possibility to avert some of the worst aspects of the nutrition transition in low income countries that have not fully entered into that phase. And I think some of the purpose of this work is just to understand the relationship between diet quality and income. So, what do we expect to see as countries try to develop or raise the living standards of the population? So in Malawi, it is one of the lowest income countries in the world, where about 90% of the population can't afford even the least expensive available diet that meets dietary guidelines. So that's from the SOFI report, and that's about 20 percentage points higher than the average in low income countries. So about 70% of people can't afford the least cost healthy diet elsewhere in low income countries. So Malawi is in a sort of in that lower range, and so it's a very interesting place to understand how, as incomes change, diet quality can change as well. So we also see in Malawi lower rates of non-communicable diseases than in neighboring countries. There hasn't been a ton of progress in lowering rates or in stabilizing the prevalence of some of the diet-related non-communicable disease. So it is, again, a case where I think information can inform interventions to avert some of the worst parts of the nutrition transition. So we know from a very large literature on the relationship between income and diets that the responses to income are very dependent on context. So sort of the most basic thing that people looked at, some in the earliest work, is this relationship between income and calories. So before people had started to worry about nutrients and food group consumption, people were very focused on, are people getting just enough calories? And we know that there is a relatively inelastic demand for calories. So that 1% increase in people's income leads to a much smaller increase in calories, which is consistent with what we know about, people maintaining energy balance. But even in this sort of most basic setting, we know that there's huge range in how people respond to increases in income, and it depends a lot on how that income is received. So among people in a variety of countries who received a conditional cash transfer, that elasticity is much lower. And for people in a recent experimental study, there was evidence that people had a much higher elasticity, closer to 0.7, when they received an unconditional cash transfer. And those are some of the poorest people in Kenya who received that cash transfer. So even this elasticity of demand for just for calories is quite context dependent. One in recent years, people have been much more focused on elasticities of demand for nutrients and for food groups, which is an important change in how we're focusing on things, just like we're focusing on the entire diet rather than just whether people are getting enough calories. We're now trying to focus on the quality of those calories. But there's um, quite a lot of difference between the elasticity of demands for nutrients and food groups. In six sub-Saharan African countries, there was a lot of variation even among the poor by nutrient and by the six countries, which led to very different results in what type of interventions would be most useful to change to improve people's diets. We see that vitamins and minerals are much more income elastic than macronutrients in Nepal. And then there's other work on things like the elasticities for fruits and vegetables, again, now looking at fruits and vegetables in other settings. So then, of course, there's a lot of other work that focuses on the other aspects of physical and economic access to diet, to the components of a healthy diet, that I'm not really focusing on here, but just to say that we know that the context matters a lot. And so looking at some of the lowest income countries like Malawi is kind of a helpful exercise. So the contribution of this work is to try to describe the relationship between overall diet quality and income. Now, as with some of the more recent work, focusing on food groups defined for health and to focus on metrics that look at overall diet quality rather than just individual groups and try to understand how we expect people's again, yeah, overall diet quality to differ across the income distribution in one of the lowest income contexts. The specific hypotheses that I'm looking at here are that the relationship between income and diet quality is nonlinear and non-monotonic. And the idea here is that there is a possibility that at higher incomes, even in this very low income setting, that at higher incomes, people have worse diet quality than at the peak somewhere along the middle income spectrum. So that there's sort of this inverted U shape. That is the hypothesis here. Is that and the rationale for that is that diet composition changes with income in a nonlinear way, where when you get wealthier, or not necessarily when you get wealthier, but wealthier households consume lower or stagnant levels of fruits and vegetables, legumes, nuts, and seeds, and whole grains, these components that these food groups that are sort of considered to be less commonly consumed in the nutrition transition, and more of the refined grains, oils, and fats, and sweet and salty foods as people get wealthier or among wealthier households. When you can buy those things, the idea is that people do, and that their diet quality will be lower. So the specific hypothesis is that there would be an inverted U shape to the relationship between diet quality and income in this setting. Just a very quick preview of the results is that we find that for the majority of this distribution, diets are just improving as incomes increase. We do find an inflection point where diet quality levels off. There's no evidence of in fully inverted U shape. So I'm going to go into the results here. I just wanted to give you a brief in case people can't stay for the whole time, and to lead you in the right direction. But I'm going to describe a little bit about the data first. So I'm using the Malawi Integrated Household Panel Survey, which I'm sure some of you are familiar with. This is the Living Standards Measurement Survey from Malawi. So there's 4 panels beginning in 2010, most recently in 2019. This is a nationally representative panel. And the main data that I'm using for my outcome and variable is the diet data from a household recall over the last 7 days. So there's about 142 foods that are included in the food consumption module. One family member is asked about what the household consumed over the past 7 days. It's a very common type of module for the LSMS surveys or other household surveys. So what we do is we use an energy adjusted consumption per adult equivalent. So we take all of the information on the quantity of foods that people ate, converted into standard units like kilograms, then turn it into calories. And then based on the age and sex composition of the household, we can determine what we believe the energy intake should be, and we can scale down the energy consumption to match that. So the reason for doing the energy adjustment is to account for people's difficulty in reporting what they actually ate. So many people report consuming many more calories than is feasible for them to have consumed. So that's what the energy adjustment does here. And we have all the information on the household composition from the household roster. So basically, we're using the total energy intake per adult equivalent to generate the diet quality metrics. And then for income, we use total consumption expenditure, which is an estimate of all of the things that people have spent money on, including the things that they produced, including gifts and things in kind, and then also um, then their actual expenditures. So those are the primary data. Of course, there's many other modules, and I'm bringing in those variables into the analyses. Let's see. So for this work, I'm measuring diet quality mainly across two dimensions, and then the third dimension sort of check on the first two. So the first dimension is on risk factors for poor diet quality, and I'm using the global diet quality score. This is a slightly modified version because the original global diet quality score is based on a 24-hour recall for an individual. Others in the literature have adapted this to use it for things like household recalls. So basically, the household global diet quality score is um, based on 16 healthy, 7 unhealthy, and 2 conditionally unhealthy food groups. It was validated for global use in assessing overall diet quality, so both looking at diet-related disease and then the risk of undernutrition. So that is a useful metric for looking at overall diet quality. And we focus on, this is sort of one of the main metrics that I'll be using. The range is from 0 to 49, where 49 is a better level of diet quality. Then we use a measure of food group adequacy. We're calling that mean food group adequacy. And that is based on adherence to dietary guidelines. So we're looking at the recommended intake of calories across food groups. And I'm using the Healthy Diet Basket as the which is the global standard for monitoring cost and affordability of healthy diets. So we're looking at the proportionality of calories across food groups and whether what people report consuming aligns with what's recommended in the Healthy Diet Basket. That is also a metric where a higher score is better. So I'll show you the details of calculating mean food group adequacy, but essentially a score of 1 would mean complete alignment with the Healthy Diet Basket recommendations. And then we also calculate mean nutrient adequacy, which is just the mean adequacy ratio for 18 macro and micronutrients. And I won't show that very often in these figures just um, because of time constraints, and it's more of a check on the other two, which are our main outcomes. So to calculate mean food group adequacy, it's a very simple metric that's just a simple average of the deficiencies from recommended calories per food group using the 6 recommended food groups in the Healthy Diet Basket. Some of you may be familiar with this, but there are the 6 food groups: starchy staples, oils and fats, fruits, vegetables, legumes, nuts, and seeds, and animal source foods. So the idea is that people would be aligned with the calorie targets listed here in the third column, and deviations from those calorie targets would result in a lower score. So as an example, in this first diet, you have the Healthy Diet Basket target. These are the calories per day from the Healthy Diet Basket. So if a person were to have consumed this many calories, there would be no difference between the recommendation and the actual consumption, and you would have a mean food group adequacy score of 1. Then in this other example, we have deviations. Sort of all of these calories are uniformly taken from the different food groups that are recommended, but this household would be consuming 570 calories of a sugar sweetened beverage, for example. And this person, or this household, excuse me, would have a score of 0.755. So we sum up the deficiencies and add 1. It's not a particularly important detail. The basic thing to know about the metric is that a higher score is better adherence to the dietary guidelines, and the rescaling is simply to make that true, so that a higher score is better diet quality, which is how mean adequacy ratio is also interpreted and how global diet quality scores also understood. So now for the methods. I use a couple of different methods to explore this relationship. I start with a very simple non-parametric bivariate relationship. We're just trying to understand, what is the basic shape of the relationship between income and diet quality? So we're not including other variables, we're just including those two, and we're just looking at the shape using local polynomial regressions. Then to try and get a clear um, assessment of the magnitude of the relationship, we use a parametric multivariate analysis. So we're using two-stage least squares instrumental variables regression, primarily just to address measurement error here. The focus of this analysis is really a descriptive correlation. We're not trying to address the endogeneity or not trying to do causal inference here. We're truly just trying to describe the relationship. But because there's quite a lot of noise in the variables, the IV does help address the measurement error, excuse me. And then we use semi-parametric multivariate analysis to improve on those first scatter plots where we're just looking at diet quality and income. And we use a relatively recent bin scatter method to try and to actually test whether the shape of the curve is statistically significantly different from being linear or non-monotonic. So those are the basic methods here. And so starting off with the non-parametric bivariate relationships, again, no other variables are included. We're not controlling for anything. We're simply looking at the relationship between the diet quality outcomes and the income distribution. So here you can see the histogram in the background shows you the income distribution in Malawi. And we have, this is the log of total expenditure in 2021 PPP terms along the x-axis, and we have the various diet quality scores. So in this top left-hand quadrant, we can see the relationship between GDQS and income, and you can see that it is primarily rising throughout the income distribution. So for most people in the sample, the income as wealthier households have higher diet quality than those in the lower income, in those with lower incomes. So very straightforward. But you do see up at the upper end of the income distribution, this sort of leveling off. And it looks a little bit here like there's a drop off in the global diet quality score. It looks like there's some slight evidence of that inverted U shape. This is, again, just those two variables. But when you break this down, and I should have put it in, but I don't have it here. This is very heavily driven. The shape here is very heavily driven by one of the panels. It's the first panel from 2010. So that's some, so we don't have sufficient evidence here, either in the method or in the actual results to reject this hypothesis that the relationship is monotonic. So we can't say that there's that downward or inverted U shape here. We see it looks a little bit more pronounced for mean food group adequacy, but the same thing holds. So we see relatively consistent results across the three different metrics here. And I think that actually the biggest takeaway from these three figures is that diet quality is very low, even for the wealthiest households here. So for the example, for the diet quality score, there's a population-based cutoff around 15 that's meant to indicate just moving from very high risk of poor diet quality to a lower risk of poor diet quality. And most people in this distribution are below that level of 15. So the maximum, whereas the peak here is around 16. So people's diet quality is quite low, even for the wealthiest households. Again, insufficient evidence to support the idea of that inverted U shape. We do not have evidence here, and it's mostly driven by that 2010 panel. We also see when we're able to break down the global diet quality score, there's two different subscores. There's a subscore based on the consumption of the healthy food groups and on the unhealthy food groups. So remember, there's 25 total, 17 of those are conditional or healthy, others are unhealthy. And then there's also conditionally healthy food groups, which are, depending on the quantity consumed, can be contributing to health or not. So when you look at this breakdown, you can see that both subscores are positively correlated with income. So these lower or worse scores, they're wealthier households are doing better on the unhealthy components. They're eating less of the unhealthy components and more of the healthy components. So it's a little bit confusing, I think, to interpret that unhealthy score, because a higher unhealthy score is a good thing because we're summing up those scores to get the higher global diet quality score. So what this is showing is that wealthier households are doing better on both submetrics. Just that there's clearly a leveling off of that improvement. There's not, or it's not an improvement because this is not change over time. The wealthier households, after a certain point, they're not doing even better on that unhealthy or healthy metric. There's a leveling off. So yes, we see that the lower scores are driven by high consumption of refined grains and high fat dairy. So in this case, I think it's primarily driven by a lot of consumption of maize flour. So it's not lower income households are just eating more maize flour. So it's not necessarily that wealthier households are eating a lot of whole grains. It's that the quantity consumed in the lower income households is just a lot greater. So that's contributing to the score. And then these higher scores reflect low consumption of sugar sweetened beverages, processed meats, and juices. So these are pretty good scores overall on the unhealthy submetric. So consumption of almost all of the recommended food groups remains below intake targets based on the healthy diet basket. So, oops. So for starchy staples, again, along the x-axis, we have the log of total expenditure in 2021 PPP. And then on the y-axis for all of these, we have the energy adjusted calories. So here you can see that there is a big difference between the lower income households and the higher income households in terms of how much of the starchy staples they're consuming, but even the wealthiest households are still overshooting on starchy staples. Oh yeah, and the red dashed line here is indicating the healthy diet basket target. So you can see we see that increase a little bit even at the highest income households. Oils and fats also tend to surpass recommendations for the highest income households, but generally households are doing pretty well on meeting that target as they get wealthier. We see that vegetables and fruits are very far below recommended levels, which is a common finding in many, many countries, not just in Malawi. That legumes, nuts, and seeds has a very interesting shape. It actually does seem to have that inverted U shape where people are in the middle part of the income distribution are actually achieving healthy diet basket targets for legumes, nuts, and seeds, but then wealthier households are eating fewer of them overall. So there's a little bit of a plateau and drop off there. Same thing for animal source foods. Those households in the middle of the income distribution are getting closer towards that target, but still undershooting it. So, and then discretionary foods, there's not that many calories allocated to discretionary foods at the lower end of the income distribution, and there's quite a lot of noise at the upper end. But we do see households consuming a lot more calories from discretionary foods here among the wealthier households. So again, these are all just the bivariate distributions. Oh, I'm trying to move forward and it is not progressing. This seems to keep happening to me. There we go. Okay, got it. Okay, so now for the parametric analysis. Again, I mentioned that I'm using instrumental variables just to deal with measurement error in these variables and to estimate the average relationship between diet quality and income. We're trying to get at this point estimate that's helpful for understanding the overall, just trying to come up with a summary of the overall mean relationship between diet quality and income here. Use an asset-based wealth index as the instrument for income. And in this two-stage least squares setup, we're looking for this beta, which is the coefficient on the log of total expenditure. And we're hypothesizing that this coefficient isn't sufficient to describe the relationship, that just looking at this point estimate isn't giving us the full story. And so, but we still want to have that. So when we look at the results here, there's three three different specifications. I just want to point out that we initially started out using household fixed effects in order. I mean, that's one of the great benefits of having this panel data. Unfortunately, it is an unbalanced panel, and when we use the fixed effects for the household, we lose a lot of households, quite a lot, or only in one round. So for most of the specifications that don't actually use the panel, but I just wanted to show you the difference between what happens when you use the panel estimate and when you do not use the household fixed effects. So basically, the main thing to notice here is that uh, the effect is statistically, or the relationship between diet quality and income is statistically significant. But when you actually put it into context, it's a very, very, very small effect or so. So a 100% increase in income would be associated with about a 3-point increase in the global diet quality score. That's from a mean global diet quality score of about 11.5 on a scale of 0 to 49. And so this is still, even with that 3-point increase on average, you would still have many, many people falling below that threshold of 15, which is considered just to getting people out of this high risk for poor diet quality threshold. So we see very similar, the finding is similar for the other metrics. There is a statistically significant relationship, and yet the relationship is very, very small. So now moving on to the formal test to describe the relationship and describe whether the relationship is nonlinear and non-monotonic. So here I'm using these bin scatter commands. So basically what you are able to do, it's basically a semi-parametric regression in which you're able to control for covariates parametrically. So now this is basically expanding on those initial non-parametric bivariate relationships, but now I'm able to control for covariates. I'm able to include the household and panel year fixed effect if I want, and formally test the shape of this relationship. So when using these bin scatter methods, we find that there is a nonlinear and non-monotonic relationship. So we, unlike with a non-parametric bivariate figures earlier where I told you we can't conclude that there's a non-monotonic relationship, here we actually are able to reject that hypothesis that the relationship just increases with income. So it does not only increase with income. When we formally test it, we don't find evidence of the inverted U, but this is formally telling us that this leveling off of the relationship is statistically significant. So these wealthier households are, the relationship there is different statistically from the relationship with the rest of the distribution. So that is an interesting finding that we can extract from the bin scatter methods. It's a little bit different from just looking at the initial relationship. And the main conclusions here are that for most of the distribution in Malawi in this low income setting, diets improve as households get wealthier. So wealthier households have higher diet quality than lower income households, but they're still very, very low relative to what would be considered a protective level of diet quality. There is this inflection point where diet quality seems to level off, where wealthier households don't have better diet quality than those who are less well off than them, but still doing fairly well. And part of that seems to be related to this overconsumption of starchy staples, low and stagnant consumption of fruits and vegetables, and some displacement of healthy food groups by sweet snacks. I think that's one small part of the story here. I think I will stop there, just about 30 minutes for questions, discussion. I'll let Nola take back over.
Thank you. That was incredibly interesting. If anyone has any questions, comments, thoughts, or if you want to share anything about similar research you're doing, feel free to either put it in the chat or if you have good connection, just unmute yourself and ask away.
Yeah, and just want to echo what Will just said in the chat. If anyone here, including Joyce, is from Malawi or in other countries nearby, we would love to hear how these findings resonated with you. And then if there's other folks who are working or live in, countries with lower incomes, we'd love to hear um, your reactions as well. So maybe if Joyce, can you share in the chat or with your microphone, that'd be a great place to start.
All right, thank you so much. I'm not surprised, I should say, with the results. Hello?
We can hear you, yes.
Yeah, we hear you. Yeah.
Okay, thank you. All right, so thank you, Rachel. I was saying I'm not surprised with the results that Rachel just presented. It's just somehow confirming what is the situation is like here in Malawi because
Oh, I think we lost
Yeah,
Joyce.
We lost her completely,
Yeah.
yeah.
Oh man.
Hopefully she'll rejoin.
Yeah. While we're waiting for her, Rachel, one of the really striking results was with the legumes, nuts, and seeds, and
Yeah.
beans, rising and then falling.
Yeah.
I'm curious whether that was robust across the years. Did that
Oh,
change over time? It's quite a long time span in terms of the
that's true.
change,
Yeah.
in food systems.
Yeah. I don't know, but that's a great question, and I should double check that.
Emily,
Elizabeth,
that's a great point, yeah.
yeah, it is separate. It's not separated out in the analysis, but it is collected separately. They actually in Malawi they disaggregate the fish quite a bit. There's like dried fish, fresh fish, frozen fish, and then different sizes. Um, so it is possible to look at that in more detail. That's another thing that um, I could double check, but it's not. I didn't actually focus on that here. I think in the global diet quality score it would be its own separate food group. It's just not for the healthy diet basket. So then for the meat food group adequacy, but um, yeah.
And I just noticed Joyce rejoined us, which is great. So Joyce, if you're able to continue your thought from earlier, and then we can get to you, Andrea.
thank you, Alex. Yes, I'm able to hear you, but it's still cutting. So I think still this side is not stable network, but I'll continue where I stopped. So I was saying it's not surprising to hear from what Rachel presented. Yeah, from the literature that I've read about Malawi and from my basic background, it seems we are really lagging behind in terms of diversity of our diets. So when you come to Malawi, you'll see a common dish that is nsima, made from maize flour. So that one will go with what we call relish, and it usually be a protein and a vegetable. So that what has been like a local dish. So usually the proportion of these, when you see them in the plate presented to you, you will see that starch will take larger proportion and the others will be smaller proportions. So if you are well to do, you'll be able to have more relish, more meat in the plate and more vegetables. But usually the way most Malawians have grown, I think mainly due to low income levels, you'll be expected to just fill your stomach and have energy to go about, not really mindful of the nutrients that should go, that you should take to meet the minimum requirement. So from that background, with education and high incomes and now in urbanization and no understanding nutritive values of nutritive value of food, people are getting to understand the importance of bringing in other important dishes in a meal, but it's not yet there. So I'm not surprised that even when nature tried to plot this, the diet corridor against the income, you see that we are not going beyond 15. Like we're trying, but not trying to go and diversify more. So I think apart from income, the behavioral changes is also needed. I think where we can now explain more on how other foods are important to human being and also how can diversify our diets. So yeah, from IHS, Integrated Household Panel Survey, that Rachel uses one of our biggest data sets that we use here, and they are national representative, and they can also take into account the regional variations and cultural issues. So they are reliable, and yeah, I agree with the results, and to me they are very legitimate and very elaborating to the local environment that we have here. Otherwise, maybe I thought maybe Rachel would also go further to explain, to try to bring evidence on what I explained is what I've read in the literature, but maybe from the data, maybe she can bring evidence on why we can't go beyond at least maybe to on the scale of 0 to 32 going maybe around 20 or over 20 or maybe nearing the top margin with the data evidence from the data, that is. But what I commented on is what I've read and I've observed on the ground. So it would be more interested to bring out the reasons why we are not doing that much, like with evidence now, with data, if at all we have it. So that's my quick comment on this presentation. But thank you, Rachel, for detailed analysis and yeah, for bringing out this important discussion. Thank you so much.
Thanks, Joy.
Andre, do we want to go over to you next?
Sure. Thanks so much. And thanks, Rachel, for this presentation, and congratulations on the research. Of course, it's all super interesting. There's a lot that really intrigues me, and in particular, I'm interested in the use of the healthy diet indicator, just because it's kind of hard to wrap your head around when you're looking at both like the effect of income on healthy foods and then also the effect of income on nutritious foods, or sorry, unhealthy foods, and how that interaction happens. And so I'm thinking a lot about that, but and especially, so I've been doing recently some work on overweight, obesity, and the double burden of malnutrition, and kind of in the context of these double duty actions that are now being recommended. And so two questions. One, so, there's a lot that happens between income and diet consumption. So I understand that you're looking at this relationship, but in particular, I'm curious about like, does food price come into your analysis at all? So maybe that's inflation or something. How do you account for that, especially if you're looking at that relationship over time? I think there are multiple years of panels. And then also just kind of more broader, what did these results say to you? So, one of these double duty actions that is being recommended is the use of taxes to kind of curb the consumption of unhealthy foods, and also subsidies to try to promote the consumption of healthy foods. And seeing that relationship or the effect was so small, seemingly, that it looked like that increased income only improved diet a very small proportion. What do you interpret as to the utility of those types of fiscal policies for improving diets overall in a country like Malawi? So I'm gonna pause there, but lots of super interesting things, and thanks so much for your presentation. Over.
Thanks. I also, maybe other people can jump in. Joyce, feel free to jump in as well. I'll just respond to some questions from the chat really quickly. But okay, so to answer the basic question about how am I accounting for the changes in income over time, like am I accounting for inflation and prices? So I adjust all of the income and expenditure for inflation, and then I put it in PPP terms just for ease of people looking at it and interpreting it. It's also logged, so that does make it still a little bit more difficult, but I do put it all in real terms so that you can compare across the rounds. I am not, and I think I should add something on this. It's in other parts of my dissertation, but it didn't end up in this paper to add in some things on the cost and affordability of healthy diets. I do have those results for Malawi, but I think it would be interesting here just to see what compare some of the costs for people in the higher income households. Like, are the costs much higher? That I have results on that, but I haven't incorporated them here, and I think it could shed some light on aspects of this. I mean, because everything is in anyway, yeah, I think that would be an interesting addition. But in terms of the actual policy implications of this, I think that bringing in other information, for example, Ellen McCullough's work, she has some of the income elasticities of demand for the different food groups. I think that would be very helpful for designing more specific policies where you're able to, I do think there should be something done about the fact that fruits and vegetables are so stacked. I think there's been a lot of work recently trying to understand how to increase fruit and vegetable intake. It seems like it is, I think it's not very well studied, but my understanding is that it's very, very difficult to increase fruit and vegetable income or vegetable intake. And it's not very clear if subsidies would help or like specific vouchers or those types of things. I think that's a question that, to be honest, I don't think that I can specifically answer with this analysis, but I think there's plenty of information to determine a better way to target policies. I think from this analysis, there's not a very strong reason to believe that penalizing unhealthy foods would be the most helpful. I don't know. I don't want to say that really strongly. I think it's the same issue as before. It's like I don't have specific elasticities to say whether or not if people get wealthier, they would increase it more. But I don't think that it's showing us, these results show us that unhealthy food consumption is the biggest issue. I think if people were shifting some of their consumption into these healthier food groups, if they're remaining in energy balance, they're probably not going to be increasing those unhealthy sweets and snacks. I do think sugary snacks are the most commonly consumed in Malawi. So maybe if there was going to be a focus on something, you would focus on the sugary snacks, which increase the most in that discretionary, in that figure on the discretionary intake. So I think this is, along with other evidence, helpful in determining what the policy should be. But I'm assuming that I think that focusing on consuming the healthier food groups in the quantities needed is probably the most important thing in the Malawi from these results. Joyce, do you want to add anything? And I can maybe answer Tanuka's questions in the chat, Bird.
Yes, thank you, Rachel. On the policy side, I think a number of research has been done on how the biggest agricultural intervention that targets the increase in the production of staple food, we call it Farm Input Subsidy Program, is the biggest government program that is targeting to increase the production of food in Malawi. So that one mainly at first was just targeting staples, mains, and then with the issue of nutrition, I think they adjusted to include legumes. So studies have been conducted on how that has impacted nutrition. Yes, it's showing positive correlation, but still not as big as what we also found, Rachel. So it's not like direct linking, and also other programs that are there, like school feeding programs, are there to improve malnutrition, especially among children. Those ones are showing positive impact, but once the child is no longer qualified for that program, that means the problem resurfaces. So there are the programs that are through agricultural side to improve local production. But what Rachel has also presented today is also showing that it's not only through production that people are meeting their daily requirement. I mean, we call it the diet quality, but also through the market, because at first it was most understood as farmers meet people meet their daily food needs through own production. But from what Rachel has found, I think we can see that even those that maybe don't have access to qualify them being rich, but maybe they have land and they are growing, they're still not achieving higher diet quality index. So in that case, the policies that are there through agriculture are not, I should say, they are not adequate to improve on the nutrition so far, unless we have those that directly target maybe the expenditure levels of the household. Maybe that would make an impact. So on the evidence side, I think what we have usually in conclusion are the agricultural policies, but they are not much affecting the adequacy in diet of the households. That's my commentation on that. Thank you.
Yeah, my thought is that it's probably, I mean, there's quite a bit of work showing that access to markets would be more important for the diversity of the household's consumption. Again, context dependent. I haven't read that new paper. I think it's fairly new. That's looking at the 6 LSMS countries and market access versus farm production diversity to improve household diversity. But the finding is that markets are more important across most of the countries. And I should look and see what the Malawi specific results are, but that changes with distance to the urban center. So I think there's something interesting there about Malawi has put a lot of effort into these farm policies, but for many people, the market access component will be more important for a lot of the diverse foods. And that's maybe getting at what Andrea brought up as well. Like, what is the actual solution to that? Maybe if I bring in some of the cost and affordability analysis, I can also shed a little bit of light on if certain households are facing higher prices for certain food groups and what the response could be. So yeah.
Thank you.
Thank you, Rachel and Joyce. I just wanted to share that we too found something very similar in a state which is having very high rates of malnutrition in India, where we found, when we were particularly interested in milk production and consumption, and we saw that beyond a certain point, however much the household produced, the consumption was kind of stagnating at a certain point. And one of the feedback that we got in terms of when we were querying as to how to improve was that they culturally did not know how to incorporate more milk into their diets, because their diets were predominantly cereals and pulses. They just didn't know how to add more milk. So the recipes did not have that, even in other forms of milk, like yogurt or cheese or whatever. So that was one of the findings that we had, but we didn't go ahead with an intervention to validate if that would be true or not. But that was something. Thank you.
Yeah, thanks for sharing, Tinker. That's super interesting. I'm wondering if anybody else has any, either just like personal experiences in their country or things that they've read or heard about just this general phenomenon about the inverted U, the leveling off. Like, I mean, we've got a lot of different people on this call from all over. So I'm curious to hear if anybody else had anything to share. You can do it in the chat or just raise your hand and we'll call on you. And yeah, Tinker, yeah.
Sorry, I just commenting on the analysis, the dip that you are seeing at the end. I think you shouldn't be too worried about that, because the sample sizes really drop towards the extreme end. And that, although you have done an analysis to verify whether the plateauing is true or not, but whatever deviations that you see right to the end, maybe not really, maybe an artifact of the sample size also. Just thank you.
Thanks. Elizabeth?
Hi, everyone. Yeah, thank you. I really enjoyed these this presentation. So thank you for holding this session. So I'm calling in from FAO. I'm a nutrition officer here, and right now we're working on a report on healthy diets. And one of the aspects we're trying to tease apart is this element of like after the affordability element, like how people are choosing or not choosing certain foods and ultimately a healthy diet in certain contexts. And it's an area I'm trying to learn more about. So this was an amazing example in Malawi, and it's sort of giving me a lot of thought for our own writing. I see Morgan's on the call, so Morgan's working with us also on a background paper on food choice. And so I guess that's the framing that I came to this presentation with, is trying to understand how people or how we're seeing, well, with the information we have, how they're choosing their foods at different income levels. And I think that was the piece that I was more so trying to understand here, is that at FAO, a lot of the time we have this really economic focus sometimes where we say, you know, if the food is available and affordable, the healthy diets will follow, and that's not true everywhere or for everyone. Maybe ever, I don't know. I'm from the US originally, so you know, there's a lot of examples there where that's not the case. So this was really interesting, and just to say thank you very much, Rachel. And yeah, I had the question about fish because I used to work in our fisheries division, and that was a big focus for me, was looking at how different places around the world are utilizing fish, and how a choice of one means, of course, not choosing another food to eat at that time, and that will change ultimately, right, your diet quality, and fish can be a useful thing to look at there. So that's all. Thank you.
Thanks.
Thank you.
Andrea?
Yeah, so I think most of you know, but so I'm based in Uganda, and one of the studies I've been working in the past year has been done in a peri-urban area of Kampala, where among other things I've been looking at maternal and child diet and nutrition status outcomes. And you know, I went into it with certain assumptions. I now have the results of that. One of the really surprising things to me was the prevalence of overweight obesity. Even so, these are extremely poor households. And really the mothers are in really vulnerable situations. Only about a third of them are making their own income, and just anyway, they're really vulnerable. And so I was really surprised at the prevalence of overweight obesity, something like 25% for the mothers. And then also the children. So I mean, I know like for dietary intake, actually for any study, like you never get 100% of anything, right? And so I had 281 participant, like mother-child dyads in the study. Every single 100% of those children under 2 had consumed a sugar sweetened beverage in the past 24 hours, which just blew my mind. So I guess I'm curious. I think, Rachel, you mentioned at the start of your presentation that you're mostly interested in undernutrition. But I am curious, like if you included in the manuscript, any nutrition status outcomes, like just to give an idea of what the prevalence of overweight obesity is, in addition to maybe, you know, underweight. And then also, I'm just kind of curious, you know, the data that you have in terms of diet is at the household level. Do you have any thoughts about how your results might differ, or, you know, is there any kind of other data that you could draw on just to kind of explore the impact at the individual level? Thanks. Over.
Yeah, that's a great point. I don't have data on the household survey does have some information on child like underweight. Like we can look at wasting, stunting, but we don't have any information on the adults in the household, and it's not for all children, so I don't use it. I do think in terms of, I don't have a good sense of whether the taking the household diet and putting in adult equivalent terms is very appropriate for Malawi, completely inappropriate for Malawi. I just don't have data on that, on intra-household allocation of the food. I mean, I think it's commonly done, and there is research showing that people are clearly not getting exactly in the household what they're supposed to be getting in terms of just what their age, sex. Wow, sorry, I'm not speaking clearly at all. Just because you're supposed to be eating a certain number of calories doesn't mean you're getting that just because the household is consuming the overall number of calories. Obviously, I don't know whether that is true for Malawi or not, like how far off we are. I do think I could look at the data from the diet quality questionnaire for Malawi to look at whether adults are consuming, it's not going to be in the quantities, but like yes or no, are the households, male and female households, consuming things in line with what I find in the survey? And then I'm sure there's some way to use that data to validate some of what's in the integrated household survey, but I don't know, I haven't done it. It's an interesting point, and I don't know if others have done it or others are working on it. It seems like it would be an interesting area of research, but yeah, I haven't looked at that. I mean, they only have it it's like a nationally representative sample for men and women, right? I think for the DQQ. So I'm not sure how helpful that would be, but it's a great point, and it's just completely a limitation of this data source. And in my analysis, I can't say anything about that particularly, but yeah, it's an interesting question.
Great, thanks, Andrea, and thanks, Rachel.
Yeah.
Just mindful of time, I wonder if there's one more question or comment from maybe someone who hasn't shared yet, maybe Seth or Benush, Morgan, anybody else? And if not, anyone else, this is welcome to share as well.
I'll also just mention quickly, Joyce is presenting at one of our research roundtables in 2 months' time on November 5th. So we may continue some more of this type of conversation then for anyone who wants to join that. And for Elizabeth, you mentioned you work on some like food choice and behavior, what drives those choices. Next month, our roundtable is going to be focusing on drivers of food choice amongst women in Tanzania. So that might also be interesting to some of you on this call, and we can seemingly continue some of this conversation in both of those roundtables as well.
And Benush, if you have work from the Canada context, from your organization, or Seth or others, that you would want to present in future months, definitely please be in touch with Nola.
Can I make one more small comment based on what Tinku just said and what Andrea said earlier? I think it would also be interesting at some point to talk more about the sensitivity of these metrics to changes in people's diets. Like the mean, so for global diet quality score, because everything is based on threshold, changes in consumption for the household, especially based on inter-household allocation, but just in general, it's very hard to push up into that higher threshold to get more points for certain food groups. So the range of like, you get 1 point for consuming this wide range of things in the, in each food group. So getting from 1 point to 2 points might be unreasonably difficult in this setting. And so I don't know exactly how to think about that. And I also think it's very interesting for the mean food group adequacy question. Will, you and I have talked about this a long time ago. The mean food group adequacy metric doesn't penalize people more for certain types of unhealthy foods, and like it doesn't, there's a maximum of how much you can be penalized for something. So I think there's something interesting there about like Joyce, you asked like why can't Malawi push past 15, or like why are all these households stuck in this section? So there is something about the metrics here. I don't want to like, I think that deserves more investigation. And if anyone here wants to do it, I think it'd be really interesting, or for another call. But
such a fascinating area. We don't know very much about dose response and whether these small increments are actually making a big difference to health or not. So Tinku, this is, you know, definitely your area in terms of mechanism, right? And getting sensitive and specific metrics that capture these changes for these populations is a big challenge.